Kidney disease is a struggle faced by many Americans each year, many of whom are forced to rely on dialysis to help address the insufficiencies of the kidneys. Dialysis is a medical procedure that replaces the function of the kidney by externally cleansing the blood of waste and returning that clean blood back into the body. The sheer volume of blood that needs to be cleaned and the frequency of cleanings makes dialysis a very lengthy process. As a result, surgeons have created a surgical connection between a vein and an artery called an arteriovenous fistula, allowing for the bypassing of the capillary bed, shortening the time of treatment. However, many AVFs tend to fail due to thrombosis and stenosis, and no current quantitative and frequent monitoring methods occur for maintaining AVF health, which results in a huge financial burden on the U.S. population. In order to address these issues, I introduced the AV Fistula Thrillometer. The AV Fistula Thrillometer is a device that consists of two piezoelectric sensors in a differential layout that help to identify localized vibrations while filtering out systemic noise such as heartbeat. This device provides continuous live data on the health of an AVF by detecting the specific vibrational waveform being outputted. The end goal of this device is for it to determine differences in the vibrations that occur as a result of changes in the fluid flow due to the onset of the failure conditions of stenosis and thrombosis. When this device was tested on an in vitro model of an AVF that had the ability to replicate the failure conditions previously mentioned, a difference was noticed in the vibrational waveform, as when failure was induced, there was a significant decrease in mid-range frequencies easily noticeable on the plot. The widespread deployment of such a low-cost solution would allow clinicians to detect otherwise unnoticed changes that would ultimately lead to failure, allowing for earlier intervention in AVF health. Moreover, such a device can be used by patients outside of clinic, at home, or any place they see fit for frequent and continuous monitoring that could then store the data for further use. Such a device would allow patients to retain more control of their treatment and improve their quality of life significantly.